In this video, I'm going to show you the groundbreaking results from a 2024 study that reveals women with pleural mesothelioma may live nearly 4 years with a specific lung-sparing surgery. I'll show you exactly what the surgery involves, the survival results, and who may benefit most. Let's get into it. Hi, I'm Deborah from Surviving Mesothelioma. Over the last 20 years, we've helped over 18,000 mesothelioma patients understand their treatment options, including surgery for mesothelioma. Today, I'm going to share some research from a scientific journal called Translational Lung Cancer Research. In 2024, they published a study on surgery for mesothelioma. The study involved 114 women with pleural mesothelioma over 11 years. So here's what you're going to see today. First, what this lung-sparing surgery actually is and how it works. Second, the surprising survival results for women in this 2024 study. And third, who may be the best candidates for this procedure based on the research. So let's start with what the mesothelioma surgery is. It's called extended pleurectomy decortication. And this is a lung-sparing surgery that removes the pleural lining and the tumors while keeping the lung intact. But why should you care about this approach? Unlike more aggressive surgeries that remove the entire lung, this approach may preserve breathing function while still removing cancer, and that is huge for quality of life. So how does it work? Surgeons remove the affected pleural lining and then any visible tumors from the chest cavity, but they leave the lung in place. Think of it like carefully peeling away the diseased lining around the lung without damaging the lung itself. The goal is to remove as much cancer as possible while preserving the patient's ability to breathe normally. You may have noticed the term extended in the name of the surgery. So extended means that they do take out more than just the regular version of the surgery. In the language of the doctors, extended pleurectomy decortication, EPD, and pleurectomy decortication, PD, are surgical procedures for treating malignant pleural mesothelioma, but EPD is more extensive, involving the removal of not only the pleura, the lining of the lungs, and the tumor, but also potentially the diaphragm and or the pericardium. The diaphragm is a dome-shaped muscle that separates the chest cavity from the abdomen, and the pericardium is a fibrous sac that encloses the heart. But the surgery alone wasn't the whole story. The surgery was also combined with heated chemotherapy during the operation and often followed by additional chemotherapy. So this comprehensive approach targets cancer cells that surgery alone might miss. During the operation, heated cisplatin chemotherapy was circulated in the chest cavity for up to 60 minutes at 42 degrees Celsius to kill any remaining cancer cells. And the results? The research showed women had a median survival of 38 months, which is over 3 years, with 28.2% surviving 5 years. And that is almost 1/3 of the female patients surviving 5 years. But here's what's even more encouraging. For women with the epithelioid cell type who had complete tumor removal, survival was even better at 44.4 months, with 36.4% surviving 5 years. The epithelioid cell type is the most common form of mesothelioma, and it may respond better to treatment than other cell types. But why do these numbers matter so much? Most large-scale studies report a median survival of only about 9 to 10 months for pleural mesothelioma patients. But these results may be significantly better than other treatment approaches, especially for women. The 2024 study suggests that women may have better outcomes with this surgery than previously thought, and this gives hope to women with a diagnosis. So how do you determine if you might be a candidate? Factors like age, overall health, and extent of disease all play roles in outcomes according to the research. That's something that you'll need to speak carefully with your surgeon about, and ideally, you should find a surgeon that does these types of surgeries all the time. You definitely don't want someone practicing on you. And there are other important details that you need to know. This was an observational study at one institution, so results may vary at other centers. And that is why it is crucial to work with an experienced mesothelioma treatment team. The study also showed the 30-day and 90-day mortality rates of 3.5% and 6.1% respectively, which means that 1 in 17 people died within 90 days. The surgery does carry risks that need to be carefully considered. But how does this fit into other treatments? Many patients in this study also received additional treatments like chemotherapy as part of the care. This suggests that the best outcomes may come from a multimodal treatment approach, not just surgery alone. If you want to learn more about all mesothelioma treatment options and survival strategies that have helped Paul become the longest living mesothelioma survivor in the world, click the link in the description to get his book, Surviving Mesothelioma, shipped free to your door. Paul survived mesothelioma for over 27 years, and his book contains the exact approaches that he used. Remember to always consult with your licensed medical provider about any treatment decisions, and as always, wishing you the best of health, and I'll see you in the next video.